Thank you. So I see some of the people here, and I have seen some of them as patients as well. But I just want to tell you that this is a very common topic to hear talk about, and a lot of people are affected. And a general question that I normally ask to a lot of people is, who do you think is an athlete? If you want to think about it, who do you think is an athlete? Do you see an athlete as a young person who is playing for the high school or the college or professional? Do you think that that is what is considered as an athlete? In general, I would say everybody is an athlete. As long as you're doing some sort of an exercise, it is a question of how much exercise you're doing. So you can label any person as an athlete. And that's one of the common things that one has to remember is whenever you're doing any form of exercise, you can get injured. And when you're looking at a common problem such as back pain, which can affect 90% of a general population. If you will be lucky not to have back pain in your lifetime, but 90% of the chances are that you will get some kind of a back pain. So this is one of the general topics that you would want to remember is this is an extremely common topic. It affects almost everyone that you can think of. And when I say back pain in an athlete, there are certain things that we look for as physicians in a young person versus in a person who is matured. And those are the things that you would want to differentiate between the two. And as Dr. Bullock said, we don't see a lot of 18-year-old here, so this would be more geared towards the people who have a mature spine rather than an immature spine. And that's very important to remember. But I'm sure a lot of people have questions about younger because their children or grandchildren might be having issues with that. So these are the topics that I'm going to cover which can help us try to differentiate the most common causes that can affect the back, as well as what are the treatment approaches we have in our plan right now to help us take care of these kinds of situations. The first would be an anatomy. What would be general description of what the back looks like and what are the important factors that can lead to back pain. The second would be incidence, which will be, it's pretty self-explanatory. And what are the sports that are associated with back pain? Prevention is an extremely important part of this talk because that is what I'm going to focus on most of the times. And treatment approaches, which would include a general treatment plan, injection therapy, surgery if needed, and finally the take-home message. And if you have any questions, you can ask me in the end. So what are the things that you look for in the back? So basic skeleton or the structure of the bones is extremely important because that is what takes care of 80% of your weight of the torso. So the torso is the upper part of your body here, and when you are standing up or sitting, that's when the most weight gets transmitted through the bones. The second, which is also very important, are the muscles and the ligaments which hold the bones in place. And if you look at the muscles, those are the most common injuries that you will see which cause low back pain. And that's why it is important to have an understanding of how the muscles work and whether the ligaments are holding the bones in place or not. The most common things that you hear just now, I had a person come and talk to about the disc. You hear about the disc very commonly. The common causes of back pain is the fourth name on the list is the disc, which causes most of the back pain. And the last one that is known as the facet joints are a specific type of joints which can cause back pain as well. But this is what is just restricted to the spine. But when you go to a physician, back pain may not be related directly to the spine. It may be other causes which can lead to back pain. So that's part of the reason why a clinical evaluation by a physician or a physical therapist or somebody who's trained in it is important. And that helps in differentiating whether it is coming from the spine itself, which I'm going to restrict my talk to, or it may be there may be other causes of back pain, which also needs to be evaluated. So there are generally 5 lumbar vertebrae, which is the spinal bone, which is known as the vertebra, and which rests on the sacrum. And there are soft discs between the bones, which makes it mobile, because you can't have a back which is stiff, and the discs are the ones which allow you to have that motion between the two bones. The muscles that you can differentiate in or split into types of the function it does. In the sense, flexors means the ones that are in the front, which causes the spine to go in the front. Posterior are the extensors, are the ones which make it go backwards. And the laterals, which are the abdominals, basically to keep your spine straight. So this is the bone that you have. This is the disc. and this is the bone. So this is the connecting structure between the bones which holds these bones together, and this is the sacrum right here. So this is the base on which this whole spine is erected. And if you see, there's a gentle curvature to the spine here, and that is what is normal. This is known as the normal lordosis. And we'll talk about this, what does the normal lordosis mean. And if you look at a lot of people that we are sitting around here, sitting generally makes this lordosis disappear. And everybody tends to sit with a slightly slouched posture. And that is very, very common. And that what it does with that is that it puts the center of gravity right on top of the discs right here, on these discs. And that's what causes a lot of wear and tear. So when we are talking about posture, which is part of the prevention technique that we use, this is one of them. So this is the second anatomical slide that is important for us to understand. And this gives us the anatomy of the disc here. This is known as the annulus, which is kind of a fibrous structure which Dr. Bullock was mentioning, how the cartilage is. This is a different type of cartilage. It is not the same type of cartilage which is present in the knee or the hip. It's similar to, if you were to get an analogy, it is similar to the meniscus which Dr. Bullock just mentioned. It is similar to that, but the only difference in this one is this holds the center, which is the nucleus or the soft part of the disc within the confines of the annulus. So this is very important. If there is any tear in these fibers right here or right here, which is the most common spot where you get a disc herniation, is this material, which is the jelly part, is the one which comes into the spinal canal. So when you hear about what is known as a disc herniation, this is exactly what's happening. There's a tear or a rent in the annulus, and the jelly part is the one which is coming out into the spinal canal. If it goes into the front, it's usually not a big issue because there's nothing much in the front which can cause pain. Even though there are a lot of conditions that can cause pain from the front of the spine, but it does not affect the nerves. These are the nerves, the spinal canal, and the nerves which go down to your legs. Right here, it goes down like this, the sciatic nerve. And you hear about the sciatica pain. This is what it means. Sciatica pain usually starts off in this part where the nerve is coming out. So this is what you understand how the anatomy works, is to keep this jelly. Think about it like a jelly donut. And the jelly part is in the center and the donut part is in the outside, and you have a rent in the donut part and the jelly comes out. So this is what is a typical disc herniation. The importance of the disc is that as we tend to age over time, the jelly becomes harder over a period of time. So you get what is known as desiccation or drying up of the disc. And as we age, the annulus becomes thinner because it's not holding enough. So you tend to have more and more of the degeneration. So eventually what happens over a period of time is, instead of having a nice soft jelly, which is, they say up to 25 to 30 years of age is when you will have a nice jelly, and after 30 it starts to slowly deteriorate, and the most common herniations you see is between 30 to 50 years of age, because you are going through a phase where you're getting some of the degeneration of the annulus and the jelly is still not completely dried out. So you trying to get the herniations in that age group. And it can happen in young people as well as you know, in young athletes, football players, they can have it because of the excessive pressure. The second thing that you also have to remember is the nerve. This is of the spinal cord, but in the lumbar spine, which is in the low back, you don't see a spinal cord here. You have basically, majority of the times is what you'll have is only the nerve fibers going through, and that is what can get compressed, and that can lead to what is known as sciatic pain. So when we just talk about back pain, we try to differentiate between what is back pain and back pain with leg pain, because then it tends to have two different consequences. The prognosis is different, and the treatment plan may also change because of what the symptoms are. So when you have back pain with leg pain, what you're looking at is some form of a nerve compression. Either there is narrowing of the spinal canal, which happens what is known as stenosis. You hear a lot of people say, what is stenosis? So this is one of the terms that they use, is narrowing of the spinal canal because of arthritis in these joints, which is known as the facet joints, and a disc degeneration which causes the bone to grow into the spinal canal. So this is a very important anatomical slide for you to understand what are the common causes of back pain. So what we are talking about, this one is only the bones and the discs. But remember, to hold this spine in check, in normal alignment, you need a lot of other structures, because by itself this spine will not be able to hold you up. It is not inherently capable of doing it. Yeah. So what you need is the muscles and the ligaments to hold this up, and there can be injuries to those two as well. This is another view looking at it from the front and the back, and for athletes, which I'm going to spend a few minutes on, what is known as the posterior spinal segment, which is posterior means the back part. Spinal segment is the one which holds you back. So this is what is very important for the athlete, which is known as the pars intra-articularis. And we'll see a picture of what can happen with people who do a lot of gymnastics. And these are the muscles which are very, again, as I said, the spine itself cannot hold itself up. The muscles are very important in holding them. So what is the front is known as the psoas muscle, which is responsible for flexion, along with the abdominal muscles right here, and the rectus abdominis in the front. And these are the extensors of the spinal canal, which holds you up, the erector spinae and the latissimus dorsi. Okay, so you're looking at from the back, you have the long, this is one of the thoracic muscles here, and these are all long, really long muscles, and they have attachments in between to the bone, which can sometimes rip and cause some pain as well, but most of the times it heals well. And this is the sacrum on which it is held. This is from the front. When you look at this, is the rectus abdominis, which is the majority of the times is very useful in flexion, but the psoas is the most important. And the obliques. This is the one which keeps your spine in the straight line when you're looking from the front to the back. Okay, so let's just talk about what are the common causes of back pain which are related to sports. And as I said, I'm trying to restrict my talk to a little bit on the sports, but this can be applied to almost everyone that can lead to. Most common is what is known as repetitive stress. Most common, because if you look at that, the way we sit, the way we bend to pick things up from the floor, it's very common to just bend down with putting your pressure right on top of the disc and the bone, and that's what causes most of the common causes, the repetitive stress. And the more and more we do it, and as Dr. Bullock mentioned, that we are, the more and more we do, the more and more it's going to wear out. So this is one of the common causes. The second most common cause, of course, is acute injury. Acute injury is you're lifting a 50-pound bag, or the linebacker is pushing a 200-pound gentleman. You're going to herniate some of the discs, and that is an acute injury. Or you have a fracture, like a gymnast doing a hyperextension of the back and fracture one of the bones. So those are the common causes in sports as pertaining to sports. And there are certain relationships to specific sports, like as we mentioned, gymnastics, cheerleading, football, all which has hyperextension kind of injuries. I'm sure everybody has seen this kind of an image on how we have evolved being more erect. And if you look at the spine here, we are somewhat, this is even, when you look at this is somewhat not even horizontal, but this is what we started off with. And then, in the last 2 million years, we have almost become vertical. So this is not uncommon to have this sudden stress on the spine, where you are putting most of this pressure from the upper torso onto the spine. I'm sure we see a lot of people doing this now, especially about the young people here. And most of the times we are sitting in the computer and we are trying to revert back to what we came from. What are the incidents? 5 to 8% of all the injuries is in all sports. There are 15% of the spinal injuries are related to sports or recreational activity. So this is 15% is pretty high if you look at all the spinal injuries. Most common injuries are, fortunately, they are just musculo-ligamentous injuries. So that's a good thing, because the muscles and the ligaments have a higher potential to heal as compared to the disc and to some extent the bone as well. So the more you have ligamentous injuries, the better for you. As I said, most common, as you see, is ligamentous injuries, which involves rotation, because our spine, as you looked at all the muscles that were there, you looked at there were muscles for the forward flexion and backward extension and lateral, but they are not good for rotation. So there is not a good control on rotation. So the more rotations we have, like twisting motion, is the one which is responsible for the torque in the spine. Of course, contact, basketball, football, soccer, they are all higher levels of injuries. Repetitive injuries, gymnastics, swimming and diving, and volleyball. And we see a lot of with golfers, especially a lot of people are getting interested in, this is what leads to some of the facet joint problems because of twisting and hyperextension. Full contact sports, football, rugby, common causes of spinal injuries. Reported incidence of spinal injuries among snowboarders is higher than the skiers because of the way the foot is fixed on the snowboard. Again, repetitive motion and jumping. Clinical syndromes, I mentioned some of it, which is important for you to understand, is the musculocutaneous ligamentous injuries, which is the most common and most treatable. So you are in good luck, because even though back pain is common, it's much more advantageous to treat the acute injuries than wait longer and let it get chronic. Disc herniations, we mentioned some of that. Fractures and subluxation, dislocation. Again, you don't see a lot of dislocation, which is, if that is the case, then you really are looking at surgery as the only option left. Osteoporotic fractures in elderly. This is also extremely common for acute onset of back pain. If a person who has a history of osteoporosis and there is a sudden increase in the pain without any precipitating event maybe, or even like a trivial incidence of bending or lifting, that can lead to osteoporotic fractures. And this is what is important for younger athletes, where they have extension-based injury, which is known as a spondylolysis or a spondylolisthesis. So this is what an X-ray looks like. When you have an X-ray, this is one of the common things that you may see is a fracture of the pars intra-articularis. And this is what a depiction of this one looks like, where there is a fracture of that. So when this happens, there is no supporting structure in the back, and this tends to slip in the front, which is known as a spondylolisthesis. Again, this is not uncommon to see it even in a mature individual. But if you see this in a young person, then it's a better chance of healing with appropriate treatment. Even though the incidence of it having a non-union or not healing well is pretty high with this kind of an injury, because the bone is kind of a wafer thin, so it does not have enough contact for it to really heal. I'll briefly go through what we do for patients and then go through the prevention. So you usually have a clinical exam. X-rays to some extent are important. MRIs gives us a lot of information which may not be relevant, which may be relevant. CT scans are which are useful for analysis of the bone, and occasionally we use a bone scan. A clinical examination is it gives important clues pertaining to the cause. You know, when you examine and tells what is the most common cause, it is whether related to bone, ligament, joint, disc, helps us to formulate a plan of action on what is to be done next, depending on what the cause is. The most important is to assess if there is any neurological involvement, because that dictates what would be the next step. If there is a neurological involvement, weakness, numbness, problems going to the bathroom, all those things can lead to permanent damage. So you don't want to have any of those. X-rays is good for looking for fractures. Again, when we look at the elderly with acute back pain, that's one of the most common that we see. And subluxations. Again, this is also important for younger athletes who have an acute injury for a fracture. MRI. There's a big controversy on how much MRI and when to do the MRI. When most of the time people ask for it, it is not absolutely necessary to do the MRI right away, but it is important to know what the cause is. So eventually, if the pain is not getting better, then they would get MRI. The advantages and disadvantages of MRIs is a very good anatomical assessment of the ligaments and the discs. They are a good assessment of these two structures, as well as the muscles, and to see if there's any nerve compression. But there are a lot of incidents of false positive MRIs. You see a lot of abnormalities in the MRI, but it really does not mean a lot. So it is very important to have the clinical examination and the MRI and correlate the two, because that gives you the highest chances of success. A bone scan is important for a younger athlete. It would be a spondylolysis, which is a small fracture in the back part of the spinal canal. CT scans would be again for bones. Let's talk about prevention and active treatment. The most common things that we use is an exercise program, which is absolutely essential for a back situation, without which none of the other treatments would work unless you have a good exercise program and you follow up on doing those things. A stretching program and a sports specifics program. The things that we usually give information about: what is the frequency, how often, intensity, and how long do you do it. Most important for stretching is the hamstring, especially in younger athletes. The stretching of the hamstring muscles is very important, but it also should include other major muscle groups. Motion would be, when do we do it? We do range of motion daily, which has to be easy. It has to be not to be strenuous. If you have pain when you're doing it, you want to stop doing that. And about 2 to 15 minutes. Normally, any muscle group, you want to keep it for about 30 to 50 seconds of stretching. Second thing that we do is aerobic. So again, as I said, everybody is an athlete. So you want to do things which is within your limit of pain level. So you want to do as much as you can, walking, jogging, or running, depending on how much you can tolerate. Swimming is, of course, a very good way of getting aerobic exercise. As Dr. Bullock had mentioned, it's less impact on the knees and the hips, and also on the spine there is less impact. So swimming is one of the good aerobic exercise that you can do. Again, at least 20 minutes. That's what is most common mistakes that we do, is not to do it up to 20 minutes. If you do it up to 20 minutes, there are a lot of cardiovascular and other benefits, but 20 minutes is what is recommended. Strengthening program and is very important as we are getting older. As we get older, our muscles become weaker. So we have to keep a strengthening program. So these are some of the exercises that we do. This is a stabilization exercise. This is what is known as a Swiss ball. And it's very important to have a good strong back. So this is for the extension. And this is for keeping you can do side to side for the obliques. And this is for the flexion as well. So this gives you a good stabilization program. This is more of the flexion exercises. Again, sometimes people can do this, but this is what is generally acceptable without having pain. Treatment approaches, again, relative rest, physical therapy, anti-inflammatory medicines, injection therapy, which Dr. Oza is going to talk about more and give you more information on that as well. And surgical treatment, I would leave it up to the surgeons, but I'll give you a few pearls that you want to remember. Physical therapy would include exercise program, range of motion, and pain modulation. We tend to limit the use of NSAIDs and anti-inflammatory medicines. Injection therapy has specific conditions that are amenable to injection therapy, and epidural injections and facet joint injections. Surgical treatment. The most important thing that you need to remember is try to establish one-to-one relationship between the symptoms and the pathology. If you have one acute herniated disc, you have a highest chance of success. If you have more and more problems, which is more diffuse, the chances of success with surgery are less. Therapy is the most useful. Limited use of NSAIDs, injection for specific conditions, and surgery is used if there is any specific neurological conditions. Take-home message is prevention is better than cure, which we have all heard about, but I think we have to implement it. And usually low back pain is amenable to conservative treatment, and specific conditions needs more aggressive treatment. Thank you.